Interesting thing about value is we all define it differently. And anytime anybody walks into a grocery store, you can actually follow them around and figure that out based on the brands that they buy. So if we talk about brands and we talk about availability, value is ultimately defined by the consumer. Some people like speed, and that's part of the convenience aspect, and they're willing to pay more for that. Other people would prefer to go to a traditional environment, like a doctor's office, and sit in a waiting room and see them in that environment. So the definition of value as we move has to come from the consumer. That's the critical part, and that's why you can't time the market on value. You have to do the right thing at the right time. Because any given person, it's very, very different. You could define value in what is somebody willing to pay for. But from a healthcare perspective, as we move away from fee-for-service and move into the value of the healthcare, it's about access. It's about the ability to get healthcare when and where I want it. Now, the speed can vary depending on the segmentation of that particular consumer, but the value is always driven by, is healthcare being delivered to me the way I want it, when I want it, where I want it? And it goes back to basically the 5 basic marketing aspects that we all learned in school. So value going forward is going to be, and again, if you look at the mergers and acquisitions that are occurring, everybody's trying to find a different way to slice that onion. And so when providers get together, when CVS and Aetna get together, everybody's trying to figure out, what is the consumer looking for? What does the future of healthcare model look like? How will the consumer define value? Will it be telehealth? Will it be minute clinics? Will it be standalone emergency rooms and urgent? No one really knows at this point, so everything is being tested, but there will eventually be a clear model emerge.